vagus nerve, that's cranial nerve 10. That regulates blood chemistry, homeostasis.
Visceral organs and the muscle, motor muscle to pharynx and larynx.
You got it. Next one in the cervical plexus, phrenic nerve that innervates the diaphragm and keeps you breathing. That's motor and sensory. Spinal nerve C3 to C5. Threw that in there. Brachial plexus, musculocutaneous. That's on your lateral cord, and it's fastened to your biceps brachii, which is your elbow flexor. It innervates all of your muscles that are elbow flexors and also supinates, which is turns. Your median nerve, it innervates your wrist flexors and finger flexors. It also provides for the pincer grasp. It is through your brachium and your antebrachium. I was gonna say, if you guys have stuff to add, add it. So your ulnar nerve. Ulnar nerve, it runs along this vein right here. And it innervates the median wrist and finger flexors and flexion of the first 1.5 of your medial fingers. It's from your antebrachium to your elbow.
The claw disorder. Flexion.
Okay. There we go. Radial nerve innervates your triceps brachii, wrist and finger extensors. It provides the wrist drop. It innervates every extensor. Damage to this nerve, you couldn't extend your elbow, wrist, or fingers. Axillary. Axillary nerve innervates your deltoids. It's for abduction of the shoulder, and it also innervates your teres minor. Loss of or damage to this nerve would result in the loss of abduction of the shoulder joint and an upward shrugging motion. Medial. Thank you. Medial pectoral innervates the pectoral minor and pectoral major. Lateral innervates pectoral minor and major, medially rotates and adducts, and includes flexion of the shoulder joint. Your thoracodorsal nerve innervates your latissimus dorsi muscle. It medially rotates and adducts and extends the shoulder, like swimmer's arm motion. So that entire motion of a swimmer is provided by this nerve. Your long thoracic muscle, which we do not have here, but if we did, your ribs and serratus anterior would be located here, and that nerve would run long ways across that area there. That long thoracic nerve innervates the serratus anterior, which is missing here. It runs across the anterior surface, and it holds the scapula to the ribs. Any damage to that nerve will result in the scapula pulling away from the ribs. Subscapular. There we go. Subscapular nerves innervate the subscapularis and teres major. They are shoulder stabilizers, and they do the same work as the latissimus dorsi, which is medially rotate, adduct, and extend the shoulder. Suprascapular nerve innervates the supraspinatus and infraspinatus. It stabilizes the shoulder joint. femoral nerve. This big guy attached to this artery here. The femoral nerve innervates all of your quads. It's a knee extensor. Then you have your saphenous branch for saphenous nerve. That is a branch of the femoral. It's for sensory, and it's for the medial lower leg. Your obturator nerve innervates and adducts the thigh, which means it brings the thigh together, and it's located under the gracilis muscle. Sciatic nerve,
It's on the back.
yes. Turn. Sciatic nerve innervates the hamstrings, which are thigh extensors, and it's located on the posterior or the back of the leg. The tibial nerve. Thank you. Got it?
No, it's not open. I thought it was.
Oh, I thought it was open too. Oh, there it is. Okay. Tibial nerve innervates the calf muscle and the gastrocnemius muscle. It's for plantar flexion of the foot and toe flexion as well. What's this one called? Oh my gosh. The common fibular nerve goes lateral. And then we have the superficial. Oh, there we go. Oh, yes. This is the superficial fibularis muscle for the plantar flexion and eversion of the foot. This one is your deep fibular, innervates the tibialis anterior and toe extensors. It dorsiflex the foot and toe. Very, very deep here is the pudendal nerve. It's a curved nerve that exits and re-enters the body. This nerve innervates the perineum, the urinary bladder, and is responsible for erections. This nerve leads right between the legs.